This can be a devastating end to a pregnancy, and it can be filled with extreme emotions and feelings. Please seek support when you're ready. There are lots of organisations available, and they're often run by parents who've also experienced a child dying. You may hear baby loss described by different words, so I just want to briefly explain what those terms mean. So an early miscarriage describes a pregnancy lost before 12 weeks of pregnancy. A late miscarriage is the loss of a baby in the second trimester, so before 24 weeks, but after 12 weeks. When a baby dies after 24 weeks of pregnancy, this is termed as a stillbirth. If a baby breathes at birth, but then subsequently dies, this is termed as a neonatal death. If your baby breathes or has signs of life at birth, but then dies, you will be issued with both a birth and a death certificate, and so you will need to register both the birth and death at the registry office. You will be supported with this from your maternity unit. So I'm now going to talk to you about some of the things that you can expect or request when your baby dies. If you find out that your baby has died in pregnancy and labour hasn't started, you may be asked to go home and return to the unit within a few days to have your labour induced. This can be a really difficult time to process what has happened. When you go back to the hospital, you will be offered a vaginal examination, and your labour will be induced by hormones inserted into your vagina to soften the cervix, start labour, and allow your baby to be born. There is a separate video that goes through the induction process. However, this video does include talking about induction with a live baby. You can request pain relief at any time for your labour and your birth if that's what you wish. When your baby is born, they're often wrapped in a towel, and you will be asked at this time if you want to hold your baby. If you need some time to process what has happened and you don't want to hold your baby, that's fine. You just need to say. Equally, if you want to hold your baby and you want to have them next to your skin, then that's fine as well. I'd just now like to go through some of the options and some of the things you might be offered when your baby is born. These things might give you some comfort in the weeks and months and years to come. So in pregnancy, we plan for when our baby will be born. We choose a name for them. We buy blankets and clothes and toys, and we imagine spending time with them, giving them a bath, putting them to bed, reading them stories. And whilst it's devastating that your baby has died, you can do some of the things that you wanted to do with your baby. So you will be asked by your midwife, does your baby have a name? And if you've thought of a name, then give your baby the name that you chose. You'll be asked if you want your baby dressing, and you can do this yourself if you want to, or your midwife can certainly help you with that as well. You'll also be offered support to make a memory box, and this can involve things like taking photographs of your baby, taking hand and footprints of your baby. And these decisions can be difficult at the time, and if it's not something you want right there and then that's fine. You have time. It might also be a good idea to consider having the photographs taken and having the hand and footprints taken by a midwife, because they can store these with your hospital records in case you want to see them in the future. Depending on the gestation at which your baby is born, sometimes their skin can look different. So babies born prematurely can sometimes have red skin, or their skin can look see-through, and it can also be quite fragile. So touching your baby might mean that their skin can deteriorate. The hospital will offer you to use something called a cold cot, which is a cot that your baby can be placed in, which will keep them cool and slow down the deterioration of their skin. You can also bath your baby if you wish to, but it's best just to use water and not products. You may also experience your breasts leaking colostrum or milk. And some women decide to express this milk and donate it to milk banks for premature and sick babies. And some women choose to accept a medication to stop the milk coming into the breasts. And whatever you decide is entirely your decision. You can stay in hospital for as long as you wish. You can spend time with your baby. Equally, if you want to leave the hospital, then that's fine. Your baby will be well cared for. Some parents are offered a post-mortem, and your consultant will talk to you about this at the time and give you all of the relevant information for you to be able to make a decision about that. You may decide that you want to take your baby home with you, and this can certainly be arranged by the hospital. Even if you're having a post-mortem, you can take your baby home for a couple of days and then take your baby back to the hospital to have the post-mortem performed. You may also decide to have a funeral for your baby, and some local hospitals also offer a cremation service. But this depends on your area, and you will be given more information by your midwife. Please take time to grieve the loss of your baby and also celebrate the birth of your baby. You can also consider making some memories with your baby, but if this is too difficult for you, then that's fine as well. Please take care of yourself and access support when you're ready to. Thank you.